Hi there, everyone, and welcome to Making It on Mondays. Today, we're going to talk about IVF do's and don'ts, things to avoid or include during your IVF cycle. Now, Making It on Mondays is brought to you by the Acupuncture Pregnancy Clinic, which is an integrative traditional Chinese medicine clinic and an acupuncture clinic dedicated to reproductive health, to IVF support, and to pregnancy care. Now, these weekly sessions are designed to help and support those on their fertility journey and are all about empowering women and men who are trying to conceive through providing weekly workshops with relevant and research-based resources. Now, in these weekly sessions, we're going to cover topics such as TCM fertility, nutrition, and mindset, as well as tips from the experts both inside and outside of our clinic. Now, today I am your host, and for those of you who don't know me, my name is Louise Jeffrey. I'm a traditional Chinese medicine practitioner, an acupuncturist, and a coach, and I've been in practice helping couples trying to conceive since 2010. So today we're talking about IVF do's and don'ts. But before we start, let's briefly touch on what ideally we should already be working on prior to starting IVF. Number one, we should really be prioritizing our health and making sure that we're eating well, that we're eating healthy and we're eating clean. Number two, we need to manage our stress levels and really make sure that we are reducing our stress where possible using yoga, meditation, therapy, and or acupuncture. Number three, we need to make sure that we're getting enough sleep each night. So around 8 hours of quality sleep is really optimal. And if you're stuck with that, we have done quite a few lives on sleep, or speak to your practitioner who can help you to get a better night's sleep if you need that. And then fourthly, making sure that you're taking your prenatal vitamins and supplements and herbs if they have been prescribed for you. So now that we've covered off the basics, let's start on today's topic, do's and don'ts when you're in your IVF cycle. But before we start, I wanted to share something with you. Every day, embryos around the world survive in the uteruses of women who are working in fields, tending to the crops, working at checkout counters, enjoying business lunches with wine, or jumping on and off bicycles. But your embryo, your IVF embryo, is slightly different because you've put such a lot into getting this embryo this far. So for me, it's probably worthwhile treating yourself just a little bit more gently for the few weeks during your IVF cycle. Now, you've probably heard the analogy of the embryo being like a raspberry seed in a jam sandwich. And yes, it's true that raspberry seed can't fall out. But here are some precautions you might like to think about. Let's start with exercise. And the question we always get asked is, can I exercise during an IVF cycle? What is safe and what is not? Well, exercise is almost always a good thing. Right? Not only does exercise improve your overall health, but it does a lot for your mental well-being too. Now, movements such as walking and lightweight exercises are all safe. Yoga is also great. However, one form of exercise that we generally tell our patients to refrain from during an IVF stimulation cycle is CrossFit or HIIT training. And that's high intensity interval training. And the reason is because your ovaries are growing and they're becoming larger. And when that happens, exercise can really increase your risk of what we call ovarian torsion, when the ovary twists on itself, causing pain. Your body's also having to do a lot of work in the first part of your stim cycle. So from a Chinese medicine perspective, we want to preserve your qi for the work that the body needs to do during an IVF cycle. And so high intensity exercise can really deplete your qi, right? And we want to make sure you have enough qi. In the second part of your cycle, it's also good to avoid too much stretching and avoid yoga inversions or pelvic twists, just like when you're pregnant. So don't do heavy weights or do anything that compresses the abdomen or the lower back, and don't do any yoga inversions or pelvic twists. Very, very gentle stretching is okay. All right. So very gentle exercise when you're on your 2-week wait is okay. Not too vigorous walking. So gentle walking is also fine, but don't get your heart rate up too high. As what we don't want is we don't want you to overheat. And on the other side, we also don't want you to get too cold. So avoid swimming in cold water because we really don't want your uterus to get cold. We want to keep it warm so the blood flows smoothly. And that's also why in Chinese medicine, we suggest you avoid drinking icy drinks or chilled food. during your IVF cycle. All right, so a lot of patients also ask about diet during IVF, and sometimes they ask, do I have to stop eating sugar or drinking alcohol during an IVF cycle? Well, what we suggest is that starting to make healthy choices now, just like I said in the beginning, will follow you through your pregnancy and beyond. And we suggest eating mainly a whole food diet with very few processed foods. Now, if you listen to any of my other lives on fertility nutrition, we suggest starting to eat whole foods in the lead up to trying to conceive. But we also suggest trying to eat organic or pesticide free. And this is because harsh chemicals and pesticides can really interfere with reproduction and with our hormones. Now, having said all of that, the key word during an IVF cycle is moderation. So if you want to have a dessert or a slice of pizza every now and again, if you really feel like it, have it. I always work on the 80-20 rule. And if you're eating well 80% of the time, your body will be able to cope with the other 20%. All right, the next question is, what about coffee and alcohol? Well, there's no hard and fast rule here, but there are studies that have shown that even moderate amounts of coffee and alcohol can negatively impact our IVF outcomes. So we generally suggest avoiding both coffee and alcohol during an IVF cycle, as they tend to put extra strain on our liver, and our liver is working extra hard to detoxify our blood from all the stim meds, right? And we don't want to add to the load. So after embryo transfer, we pretty much consider you to be pregnant, so alcohol should definitely be avoided in the 2-week wait. All right. Another question we get is, can I travel during IVF? Now, it's really best to work with your clinic's fertility nurse when planning out your IVF cycle if you have a trip coming up, because there's going to be timings that you need to be aware of. A short weekend getaway can most likely be managed during your IVF cycle if you don't need to go in for bloods or scans, but longer trips are going to be most likely quite impractical. But with regards to flying, there's no research to support that flying is dangerous during an IVF cycle. So if you can fit it in with your IVF cycle, go ahead. The only kind of caveat to that is, international flights, especially long haul and over a time zone, can leave us feeling quite depleted and can change our biocircadian rhythm. So that might not be great for you, but it all just depends on how you are with flying, okay, and how you respond to changing time zones. Another question we get asked is, can I color my hair and can I get my nails done during an IVF cycle? What we suggest generally is avoiding fumes and perfumed skin products in particular, but mainly after your embryo transfer and during your 2-week wait. And really this is because embryos are they're quite sensitive to volatile fumes. Most IVF clinics are actually going to advise that you avoid perfumes and strong smells on your skin from embryo transfer through to your pregnancy test. And we're also going to suggest avoiding painting or renovating your house during that time, really for the same reason, right? And another thing to consider is to stay away from petrol pump fumes, because they're quite strong too. One more thing that you're going to want to avoid during an IVF cycle is really hot baths or hot tubs and saunas. The reason is that temperatures that are too high in the body can be damaging to the embryo. And this obviously applies to pregnancy as well. You're also going to want to avoid putting very hot water bottles on your abdomen around, once you've had your embryo transfer and through to pregnancy test, for the same reason. And then the last thing I want to mention before I end off today, during your IVF cycle, another really good thing to do is acupuncture. And if you haven't yet included acupuncture alongside your IVF cycle, now might be a good time to do so. During your IVF cycle, we use particular protocols that focus on microcirculation to the ovaries and to the endometrial lining. We also focus on regulation of hormones, helping you to de-stress and to relax. Now, most women who have acupuncture have what the IVF nurses call the acupuncture glow, because they are so relaxed when they come out of their acupuncture session. So I think that's it for now. I hope this has been helpful for you. If you've got any questions, please let us know in the comments box and we'll endeavor to answer them for you. If there's anything I haven't covered today, please let me know. For more detailed info and resources, visit our Facebook group or our Instagram, or sign up to our mailing list at acupuncturepregnancy.com.au. I'll be back next week at the same time. I'm signing off now. Have a beautiful rest of your day. Bye.